I'm Kapila Viges. I'm the Chief Executive Officer of MPN Research Foundation. I live in Chicago with my husband and 2 boys. I spend most of my free time with my family. They are my favorite people in the world. Hanging out in the city, playing tennis. A very important part of our family life is our travel. It was important to my husband and I that we make sure that our kids are global citizens. And so over the last 10 years, we've had the opportunity to travel to India, where my family is from. So I was brought into MPN Research Foundation in 2020 by an incredibly visionary and committed board of directors who saw an opportunity for the foundation to move to its next stage, but also were willing to take a chance on me with a very non-traditional, different background coming into the foundation and trying to take it in a new direction. And so I've spent time in academia, I've spent time in the for-profit world, I've spent time in government, and I get to bring all of that sort of diverse background into the role. We have a number of initiatives that we've built and grown over the last 5 years at MPN Research Foundation. And underlying it all comes back to that voice of the patient. To be engaged in the research, participate in our grant programs, participate in clinical trial design and development. I think that voice of patient lays the foundation for the largest milestone and biggest initiative that's coming up next for the foundation, which is our MPN Progression Registry. Being able to understand patient journeys, patient data over very long periods of time, over larger populations, is critically important. And so our call to action to the community is to elevate the urgency behind collecting this data, collecting this comprehensive data, and being able to track to the trajectory of different patient journeys so that we can better understand progression, slow it, stop it, intervene before it happens. And so it's great that we touch so many patients with these programs, but what we're really looking for is, okay, and then what happened? How did that change the outcome for the patients? Myeloproliferative neoplasms are very complex, it's very nuanced, but it also leaves a lot of room for opportunity. There are opportunities really at 3 levels. One is at the earliest stages. When we first start to see cells proliferate, try to understand when and why that might convert to an MPN. So at those earliest stages, I think there's a lot of opportunity. Then I think I fast forward to a little bit later, and we're really excited about a couple opportunities coming up around gene editing and using CRISPR technologies to be able to potentially, possibly, maybe one day go in and edit out a gene mutation and actually make MPNs curable. And I think, you know, for the first time and in this very unique situation, that is possible in maybe the next decade. Bringing new treatments to patients that can maybe not cure per se, but actually reduce the disease burden and bring the detection and symptomology to near zero, such that patients can live relatively normal lives without this worry of progression and without this worry of transformation. And that's inspiring. There's hope there. There's a lot of promise, and there's a lot of reason and urgency for people to get involved and engaged now, because that is a very real possibility. So for me, part of the vision that we have set forth for the foundation is to make sure that that social imperative that we have to help patients and make sure patients have improved outcomes is always lined up with that scientific discovery to slow, stop, reverse, prevent MPNs. So for me, that's where the innovation sort of life cycle comes in, and the biggest challenge is making sure all of those align and that we can all move forward together.